swing the tongue to eat that. Okay, yourself with the kind of history. 9 minutes after 7 o'clock this Wednesday morning. In a short while, I'm going to be focusing on an upcoming National Oncology Conference, which is happening on Sunday, the 2nd of the High Regency. But before that, we stay with health, where Nicola is going to be talking to Professor Shivananda Nayak and exploring the link between diabetes and heart failure. Nicola?
So much, Paul Richards. Good morning, Trinidad and Tobago. Professor Shivananda Nayak is here with me this morning, and this is a very important topic, looking at the link between diabetes and heart failure. Somewhere at this point in time, someone in Trinidad and Tobago is experiencing some difficulty, whether it's diabetes related or heart related. And I think this is a particular issue that some of us take for granted, Professor Nayak, and we want to talk a little bit about that. You've got a lecture coming up on, I think it's tomorrow, the 30th,
5:30
at the University of the West Indies. Thank you so much for being here with us. Let's dive right into it, the link between diabetes and heart failure, and we're looking at a term here that I'm not very familiar with, adiponectin. Tell me about this particular protein hormone and what relation it has to the link between diabetes and heart failure.
Okay, it's a protein hormone. It has 244 amino acid. It's exclusively secreted by adipocytes, that it shows. So what happens actually when somebody develops a belly, okay, I use the general term belly, when they deposit a fat, slowly the adiponectin level goes down, so that later they may get several problems. Let me say that once the BMI, what we say body mass index, goes high, the adiponectin goes down, so that there may be a chance of increase in inflammatory markers later, and there may be a chance of developing type 2 diabetes, what we say that. Like in most of the cases, those develop this low level of adiponectin, they go for insulin resistance, because this is the one actually increasing the insulin sensitivity, and later uptake of glucose. All these things through this hormone happens always with a normal person. When somebody developing a, like I say the belly, like the apple shaped belly, we say the dangerous shape of belly, once they have it, they are at more risk actually. They have to take care of their lifestyle. If they don't change the lifestyle, like eating junk food and not doing any exercise, what we call sedentary the lifestyle, so that will become the major cause for developing this type of obesity.
And I understand that, Professor Nayak.
Yes.
And I want to break it down though. So what are we saying exactly? If I am obese, I don't want to use the word overweight, because some of us are overweight, and then we have obesity.
Yes.
And I have diabetes.
Yes.
Does this put me at a higher risk of having a heart condition?
Yes, you will be at higher risk, because the risk factor, what we say, once the risk factor adds up, the diabetes itself is a risk factor once somebody is having obesity. So later with several risk factors like lipid profile, what we talk, the lipid profile, it has the cholesterol, triglyceride, the LDL cholesterol, what we call bad cholesterol, and HDL cholesterol, good cholesterol goes down, all these changes happens in a short time.
Very short period of time.
Yes.
All right, so let's look at it though. So we talk about the risk factor. If I'm diabetic, I have a higher risk of having a heart condition. But if we're looking at numbers in terms of a ratio, basically, are we saying that is it a 50, 60, 70% ratio where someone who's diabetic will have a heart condition? How high is the risk? Are we looking at a 70-30, 80-20?
It's difficult to tell that ratio. It depends on the individual. Like if someone is having a diabetes, actually, if they are on diet control and exercise, all those things, there may be chances of improving. Someone may go for pre-diabetic state. It can be reversed. You know that pre-diabetic state can be reversed if they go for the good lifestyle, like increasing their consumption of good food like high quality carbohydrates and proteins, all those things.
I like that, consumption of good food.
Yeah.
You are also an honorary consultant at the NWRH, and we talk about, I know Dr. Khan has been, and the ministry, they've been so focused on a healthy lifestyle, fighting the fat, eating right,
yes.
These communicable diseases that we encounter not only in Trinidad and Tobago but all across the globe. From where you sit, do we understand the importance of getting rid of the junk? I mean, I know we'll be putting some high-rise establishments out of business, but do we understand that? And when do we actually draw the line? When is it we're going to say, all right, fine, I'm overweight, running into obesity. How do I take stock of myself? How do I fix this? I'm already suffering with diabetes. I don't want to have a heart attack. What would be your recommendation?
Normally, actually, when somebody is having the overweight, okay, it's better for them to go to the clinic, meet the physician, and normally the physician asks for the lipid profile along with the fasting blood glucose and glycosylated hemoglobin. That's the new trend now, fasting glucose and glycosylated hemoglobin. We call it as the HbA1c. That they will do to diagnose and also the monitoring the diabetes. Now it has become the practice. So most of the clinic, they do this HbA1c when the person goes to the clinic first time or whatever it is. If somebody is having a family history, they have to take care of this. If they still go for a junk food, certainly they are going to get this diabetes, what we call sedentary lifestyle. Nowadays we see the young generation, they go for junk food even if their parents cook something at home, they don't like to eat, and they, no mommy, I go outside and eat, don't worry about that, they go for these junk foods. That has become the major problem.
That's the issue.
Yes,
that's the issue that we face.
Yes.
You grew up in India. You are from India.
Yes.
This is your 10th year in Trinidad and Tobago. Can you draw a comparison in terms of when we're looking at diabetes and the link between diabetes and heart failure, in terms of persons in India, their style, eating healthy as opposed to Trinidad and Tobago? I mean, I know we're pretty similar, but is the junk food style of living adopted in India as well? Do we face that issue?
Yes, in the major cities, it is there still, not only young generation, even adult population go for this junk food in major cities. But when we go actually inside the rural places, we don't have this habit of eating junk food. They cook at home and they work hard, like in farm field or wherever, there's a less chance in the rural areas. But when you go to the city places, we see this type of eating junk food and people with sedentary lifestyle, and there are many chances of getting this diabetes. Even in I'm from South India, I see their food habits. They eat most of the time sweets along with their food, and they put some little ghee with the food and eat all these things. Yes, so they have this obesity problem there, I saw this in India first, after I come here, I'm observing the same type of obesity here. Most of the generation, what we see here in the North India, when you go to the North India, I saw many places, they're offering us sweets wherever you go. So too much of sweets, I don't take too much of sweets. You may say, no, this is our customs to, offer you the sweets, they say that.
Dr. Nayak, your suggestion, what would be on a daily basis, breakfast, lunch, dinner, your suggestion as to meals?
Yeah, have a nice breakfast in the early morning with some cereals, the oatmeal. Oatmeal has a good fiber, it increases the absorption of the glucose. So that's the literature says that already, And not only that, when the lunchtime comes, eat as much as possible, rotis, all those things, skipping this carbohydrate as much as possible, and skipping this white starch, white potatoes, all these things. Maybe in the night, actually, you can have little food, the dinner, what we say. Immediately after the food, people have the habit of going to bed or watching in front of the TV.
We eat and lie down.
Yes.
That's what
in front of the TV, they sit there and eating the food. After that, immediately they may get a sleep, they sleep after that.
And then
this is a bad habit. This is a bad habit, So have your dinner a little early and have some walk here and there and spend some time. Later it's going to bed, it's always better,
I
and more than that, some people have a habit of eating very fast, that's not good. That's not good. Yes.
Professor Nayak, thank you so much. I don't want to give away much of what the lecture is going to be about now. The lecture takes place at Amphitheatre A, Faculty of Medical Sciences, Eric Williams Medical Sciences Complex, Mount Hope at 5:30 p.m. That's tomorrow, and it's actually the professor's inaugural lecture that should be, and we're looking at exploring the link between diabetes and heart failure. I've been chatting with Professor B. Shivananda Nayak, Senior Lecturer, Department of Preclinical Sciences, Biochemist, and Honorary Consultant at the NWRDG. Thank you so much.
You're welcome.
So we're moving from one health aspect to another health aspect. Paul Richards, you are in the hot seat. Good morning, TNT.
Thank you once again. 20 minutes after 7 o'clock as we continue, yes, focusing on